have seen a headline coming out of a press conference from the WHO, the World Health Organization, that appears to sort of contradict a lot of what we have learned about COVID-19. And it had something to do with the WHO saying that asymptomatic patients rarely spread the disease. Vlad, as you know, part of the conversation that we've been having is the concern that you could be asymptomatic and infecting other people, people who are more vulnerable to the disease. You don't know you have it, and then you make other people sick, which is why masks and social distancing is so important. So we hear this news coming out of the WHO that perhaps asymptomatic people are not infecting others as often as we thought, or it's very, very rare. So we want to dig into this because a headline is one thing, but what is really being said? We want to bring in pediatrician Dr. Dyan Hes. You are here in New York. You're a pediatrician, and the reason that it's very, very important to talk to you about this is because we've been told that children are often asymptomatic, and so we should be careful and don't allow them to be around their grandparents because they're more vulnerable. But can you, for me, dismantle the headline from what the WHO actually said?
So the headline is so misleading. And honestly, I feel like the WHO has been doing a disservice to all the work that we have been doing, especially in New York, Detroit, Chicago. Cities have been hit so hard. So there's pre-symptomatic and asymptomatic. So people who have COVID are pre-symptomatic 2 or 3 days before they get really sick. So they're considered not symptomatic or asymptomatic, right? But they have the virus and they shed it, and we know that. And that's usually the people who are spreading it to others. Now, there are people who get coronavirus and have a very mild illness. What that study says is about 40 to 60% of those patients who said that they were asymptomatic really did have symptoms. They had some kind of runny nose or a little bit of a fever or some diarrhea, whatever it is, they had something, but they thought that they were asymptomatic. So I think studies show in Singapore, Hong Kong, China, all over Asia, the way they shut this virus down in Israel is that people wore masks and social distancing. And I don't think that should change.
That's a good point that you make, Doctor. And we should point out that the Israelis are actually pulling back on some of their reopening measures because they have seen spikes in COVID-19 cases recently. So that has been put on hold. I should also note that the Washington Post had a really interesting story this morning that there are 14 states since June alone, and we're only in the first week of June, that have seen significant spikes in COVID-19 cases. And unlike the early stages of the pandemic, where they were concentrated in the Northeast, in New York and California, these states, many of them are in the South and in the Midwest. So the point that you're making, Doctor, is the one that I just sort of want to reiterate, that this headline from the WHO is not a license by people to say, well, you know what, I don't need to wear a mask. I don't need to keep 6 feet apart from people. In fact, that recommendation is still in place because, and it's clear what you just said, that there is asymptomatic and there is pre-symptomatic. In other words, you can become infected with COVID-19, and for 1 or 2 days, you can infect other people before you come out and you yourself get sick. That does not mean you were asymptomatic, right? It means you were pre-symptomatic.
Right. And most people who thought they were asymptomatic really weren't. They had a sniffle, they had a little stomach ache, they might have had diarrhea. So I feel like those WHO guidelines or recommendations now are giving people a false sense of security. So you see the spikes again in Israel, they open the schools, but Israel's a very small country and they were able to shut it down. They do great contact tracing. They closed everybody who had contact with those kids in the school, with the teachers. They were able to contain it. But we will not be able to do that with every state having different guidelines and other states that are having increased numbers still opening to phase 2 and phase 3. It's beyond scientific understanding how they can do this for me.
So, Dr. Hes, I want to ask you about some of the other health risks that we continue to face because of the pandemic, because, schools continue to be closed and, we don't know what's going to be happening with camps. And you're a pediatrician, so the whole health of the child is what's important to you. I'm wondering if you're concerned because many children are not going to be going to camps where they would be supervised. They may be at home with parents who are still remote working and so can't keep an eye on them. Are you concerned about an increase in accidents, pool drownings, things like that, because parents will be busy and it'll be hard to watch the kids.
Yes, and I'm going to grab something right here on my desk. So they're all tangled up, but we actually give every patient who comes in now for the summer a tag, and it says, "I am the water watcher," because parents are working now, they're on their cell phone, and the kids might want to go out in the pool, and the parents get a distracted phone call, and they thought the one parent thought was watching, they thought the big sister was watching, and then all of a sudden you have a drowning. So every patient who comes into our office goes home with one of those tags, and the parent who is in charge is not allowed to be on their cell phone when they are the water watcher. What we are actually seeing is more accidents, and I've been speaking to other doctors because kids are cooped up. When they get out, they climb fences now. They're jumping off monkey bars. They're by themselves. So when you're by yourself or you're only with your sibling, you have to invent an activity. It's not like you're playing a game of dodgeball or softball. So they're doing crazy, crazy things. And there's a lot of the beaches have no lifeguards. So, I walked to the beach the other day with my family, and I said to my husband, there is no way our kids can go in the ocean. There are no lifeguards here. It's so understaffed. They don't have the budget now. Things are still closed. And I said, my husband said, well, I'll watch them. I said, do you think you could pull them out of the Atlantic Ocean if they're going down? I don't think you could do that. So there are going to be more accidents. There's going to be, there's so many new things. I think that people are going to have to start cohorting together, grouping their families together. Maybe if 4 families live nearby and they've been sheltering in place and they have small kids and the parents have to work, they can rotate taking turns, not as many exposures as if they went to camp, things like that.
That's the double bubble approach. We spoke about that last week.
Yeah, because parents are at their wit's end. People have to work, and people are going to have to go back to work, right? It's phase 2 now in Long Island, phase 1 in New York City, and the schools and camps are not open. So who is watching your children?
Very important information there. Dr. Dyan Hes, always great to get your perspective. Thank you so much, as always. We appreciate it.
All right, take care. Be safe.